Hello Warm Springs, this is Taylor Gilbert, physical therapist at the Warm Springs Holistic Health Clinic. Today I'm going to talk to you a little bit about ankle sprains. So ankle sprains are pretty common, especially in our sports population, whether that's youth sports or just recreational sports as you get older. So a sprain is an injury to a ligament. It's either partially or completely torn. A ligament is a piece of thick connective tissue that it inserts on a bone and then it attaches to a bone, versus a tendon goes from a muscle and then inserts onto a bone. So that's how you know what a ligament is. It goes from a bone to a bone, and it's part of the static stability of all of the joints of our body. So you have lots of ligaments around the ankle that offer stability when you're out running, walking, hiking on even and uneven ground. So I'm going to talk to you a little bit. This is a view of the inside of your ankle, and as you can see, all that white stuff is part of what's called the deltoid ligament. It's a thick ligament that offers stability to the inside of your ankle. And when you come up here, you can see we have the anterior talofibular ligament, calcaneofibular ligament, and the posterior talofibular ligament. So those make up the ligaments that support the stability of the outside of your ankle. Commonly, as you can see, those ligaments are not quite as girthy as the ligaments on the inside. So most ankle sprains, 85%, are lateral ankle sprains, so the outside of your ankle. And how you do that is with your foot turning in. So that's called inversion. It's also called an inversion ankle sprain, like that. As you can see, my foot goes like that, and it has a propensity to injure those ligaments on the outside there. 15% of ligament injuries are either the inside or a high ankle sprain. So we'll talk about the inside, which I just pointed out, those thick ligaments there, and it would be more of a mechanism like that. So when we talk about lateral ankle sprains, we have those three ligaments that make up the stability of the outside of your ankle. And if you have a minor injury, you might have a little bit of tearing to the anterior talofibular ligament. So one of the ligaments is partially torn. Now, the more severe your injury gets, the more the other ligaments get affected. So that anterior talofibular ligament might be completely torn, and the other one's partially torn in a more severe injury. And then with a very severe injury, all three of those ligaments would be ruptured. There are other types of injuries that can mimic a lateral ankle sprain or a medial ankle sprain like we talked about. So if this is something that you feel like you have going on, I would encourage you to talk to your primary care provider at the IHS clinic, and they can get you a referral to the physical therapy clinic. Like I said at the beginning, if you don't rehab this injury properly, you can increase your likelihood of a recurrence of this type of injury. So it's really important that you give it the proper attention and care it deserves. Thank you, and I hope that helps.